Hello, everybody. This is Pam and Linda, Conversations with Your Nurse Advocates. And tonight we are going to be talking about home health. And so Linda's going to be sharing some information. And before we get started, just wanted to mention a couple of things. We did do a revision of the book. So I just want to know all of you that have a book already have the original copy, and we did try and do a little bit of correction with some margins in that. So I just want to let you know that we did notice that, and so thank you for the feedback. And so we will get that corrected. We are rookies at this book. This is our first book, but I promise the content is worth putting up with anything that doesn't look perfect. So we are a work in progress, but we appreciate that. Second thing is the website is up and running. We are going to be actually activating a form section on there, and we will have a nice checklist that Linda will talk about when we discuss home health care. But in that forms, there'll be a click box, and we're just going to ask that you just give us your email address, and we will release all those forms. And we have a medication list on there. We have a diabetic stop and go light list. We're going to have checklists. We're going to have our evacuation plan. We're going to have like a checklist there. So everybody should know how to get out of their home in case of emergency. So there'll be some tips there. And last thing I'll say is getting us warmed up to talk about home health care. In the hospital, many times is the first place where you'll have an opportunity to possibly request home health. Linda's going to talk about that. But when you're in the hospital, a discharge planner could be a nurse. There could be a social worker. There could be a case manager. They're all called different things in the hospital. And those people would be your first resource to be able to ask them about what help can you get going home after the hospital, whether you've had an illness, been hospitalized for a while, or you've had a surgery. And Linda's going to touch on that. But I just want to let you know, when you're in the hospital, that's your time to ask. If you know your surgery is coming up ahead of time, Linda will talk about too that it's always good to get a head start on those kind of things. So with that being said, I'm going to turn this over to Linda. Linda, go ahead.
Hello, welcome. Good evening, everyone. I just wanted to let you know home health, the topic of home health is something very near and dear to mine and Pam's heart. We've been doing home health for many, many years, and it's something that we grew up into, and we have been participating in many of its changes throughout the years. But one of the things that I wanted to start talking about is the actual benefit of home health. Finding the right home health agency is extremely important. It's an extremely important decision that you'll make for you or your loved one. Before you make that decision, though, it's really important that you understand that there are a multitude of home health agencies out there. If they are Medicare and Medicaid certified, they're all going to provide you similar or the same types of services. But you need to decide the agency that is right for you or your loved one. So I've put together a 20 questions interview guide for you to use, along with the answers that you should expect from the home health agency as you interview them. Interviewing your home health agency before use is one of the most important things that you can do. And I recommend that you interview at least 2 to 3 different agencies before you make a decision. They have to be a good fit for you. They have to be a right fit for you or your loved one. They're going to be entering your home environment. They are a guest there. And as a guest in your home, you get to choose who comes in and who doesn't come in. You also have the right to refuse any and all care. So interviewing these agencies prior to their use will help you make the best decision in regards to the care that they are going to provide. So that questionnaire walks through some very specific types of questions that you'll want to ask. One of them concerns compliance. The next section is around safety, both your safety, their safety, and then the other one is on finance, about how it's paid for. What does homebound status mean? They should be able to answer every one of those 20 questions to your satisfaction. And if they do, and if you feel comfortable with that, that's the agency you should go for. A lot of times, as Pam spoke to you earlier, when you're in a hospital setting, that's kind of your first realm or your first type of exposure to home health. The hospital discharge planner or case management department will determine whether you need it. And you can also ask for it. If it's not mentioned to you, you can say, do I have the opportunity to have it? Prior to any types of home health, though, they will contact your insurance company to make sure that home health is covered under your insurance benefit. If you have Medicare, it is covered under the Medicare Part A and sometimes Part B benefit. But it's something that you need to be aware of as the person who may be responsible for paying certain aspects of that bill. So as now we get into it, I wanted to talk to you a little bit about what home health is. It's used a lot of times very synonymously with other aspects. Well, home health care is actually services that are provided in your home. And these are a variety of services. There are different types of services, and they're usually provided in your home as a result of an illness and or an injury. Home health is there to provide you with a convenience, but it's also a cost-effective benefit. It is more cost-effective to be at home getting the treatment that you need to bring you back to a baseline, what we would call a baseline measure of healthcare, which would be back to your normal state prior to the surgery or the illness, versus being in a hospital for a prolonged length of time or a skilled nursing facility. Studies have shown that 85% of all individuals that have an encounter with home health actually progress more quickly to a normal baseline than they would if they were in any type of rehab facility or skilled nursing home. And the reason why is because people feel safe in their home environment. They feel the home is a safe haven. They know how to actively get around in their home. So if you're receiving home health care for perhaps a hip surgery or a knee surgery, doing that rehabilitation in your home is really a good way to do this, because you're going to be using that home environment after you get out of that rehab facility. It's an understandable way of understanding how to navigate your stairs, take away any types of safety hazards, and make sure that you can navigate in that environment. So some of the examples that home health would be in your home for would be for wound care, such as a pressure ulcer from being in bed for a long time or a surgical wound. They would also provide a lot of patient and caregiver education. 80% of the clinician's time in home health is in regards to patient and caregiver education. A lot of times they'll provide some type of nutrition therapy, could be with a dietitian, could be just with the clinician. Some of it are for injections. And then the other part is a really huge part of home health, and that's monitoring your illness and your progression towards healing. In general, the reason why someone would get home health is, one, to get better. That's why you would have home health, is to continue on that road to feeling better, to regain your independence, to be more self-sufficient as much as possible, especially if there is a therapy need, and to maintain your level of function or improve it if need be, and then slow any type of decline that may be occurring because of your diagnosis or your illness or an exacerbation of the symptoms of your illness. So if you get Medicare benefits, these benefits for home health are paid for under A. If you have care Medicare, like a Medicare Advantage plan, you would need to contact them to make sure what those benefits are and how they are utilized. You may need to utilize a preferred provider that only works with your plan. You may need to get pre-authorization. So you need to investigate those, because as well as it is part of the case management's responsibility in a hospital or in any type of facility or community to check your insurance benefits, it's also your responsibility as the guarantor to make sure that you understand those benefits and what actually is covered under the benefits or what you might be responsible for. Now, with Medicare Home Health Part A, it's a zero deductible. You don't pay anything. Whereas with the managed care, there may be, or there may not be. So you need to really check those plans. Commercial insurances, such as if you're an employee and you've got employer insurance, those benefits for home health are based on the actual insurance plan. So again, you'll need to contact them to make sure what your benefits are, how those benefits are paid for, and who you need to use for those home health benefits. One of the most important things with home health is that you cannot just ask for it and it happens. You need to be under a doctor's care, and you need to have a doctor's order in order to be part of or to utilize that Medicare home health benefit. One of the other most important things is the word homebound. You'll hear that a lot in home health. Homebound is basically what it means is you need to be homebound, which means it needs to be taxing or extremely taxing effort for you to leave your house. And when you leave your house, it has to be intermittently and infrequently. Not saying that you can't go to church, you can, but it has to be infrequent, and there has to be documentation that supports the homebound status, saying that Mr. Jones went to church this morning, but he had to take pain medication to leave the home. He needed two people to assist him to his car. When he came home from church, he had to take more pain medication, and he took a 3-hour nap. That's what they mean by homebound status. That's what they mean by infrequent. Doesn't mean you can't go to certain things or do certain things like church or to a barber, but they cannot be every Friday to a fish fry, or they can't be every day to a bingo party, because then you really are not homebound. Homebound means that it takes an extremely taxing effort for you to leave your home because you're extremely weak and medically fragile because of your disease or because of your surgery or because you've been hospitalized for a long time. What do you think you should expect from home care? That's a big question that a lot of people ask. What do I expect when someone comes into my home to provide home health care? You should expect to be treated with dignity and respect. They will use what they call identifiers to make sure you are the person that you are. You'll need to identify them by their name badge and their scrubs or their uniform. They should be wearing the appropriate PPE, especially in today's world of our pandemic of COVID-19. They will be probably calling you prior to that to screen you to make sure you're not exhibiting illness or signs of COVID-19. They will ask you some questions. They will schedule a time, and you should expect to be treated with that type of respect every time. You're also a participant in your care. The care is not dictated to you. You are actively participating in the care that you are receiving. You should be made aware of all the care that is being provided. You should be given a Bill of Rights. You'll be signing an agreement that says that home health can bill your insurance and that this is what you're responsible for. And these are the things that home health is going to do for you. You'll be introduced to your nurse, and if there's therapists, you'll be introduced to them. They should be providing you with a schedule. They should be providing you with names of the clinicians. And this is all under physician or nurse practitioner orders. This is not something that you can just do and get and take and do on your own. It is all under physician's orders. The physician is a collaborative part of your team and will be part of your team throughout your episode of home health. Home health is not something that is also done 24/7, 7 days a week. I've heard that in my experience with home health, and Pam has heard it too, that people will go into someone's home to admit them to home health, and they'll say, "Oh, you're going to be here 24 hours a day. The hospital said you would be here all the time to take care of this. You would do this for me." No, that is not how home health works. Home
Linda.
health is intermittent and episodic in nature, which means we are a supportive service. We are not the be all end all service. We are there to help educate you, teach you, and provide the care that is needed to get you back to a baseline or a normalized state. We are not there to be a 24/7 service. We are available 24/7 through our on-call or emergency numbers. And if there is a problem after hours on holidays or a weekend, home health would be there to provide support and coverage or tell you that you need to call 911 and go to the hospital. But we're not there 24/7. Again,
Linda,
it is intermittent and episodic. And that is how home health, that's always how home health has
Linda,
been.
Linda, what does episodic mean? And we have a question before
Sure.
you. First of all, and we'll go over that because I wrote down a couple of questions that I get asked frequently regarding home health. But before we move on, Katrina is on. She's a friend of Mary. She says this is a great service you are providing. Is hiring an agency like yours covered by insurance?
An agent select your nurse advocate.
Yes.
At
Yes.
this time,
Yes.
it is not covered by insurance. We are there to help you promote or help you decide on what home health agents you have. But currently, our services are based on a cash basis. Hopefully, at some point in the future, we would like to contract with certain insurance companies, but at this time, we are not. But we can then provide you with information through our our website and through discussions with us and through these Facebook Lives, information in regards to making the right decisions for you in regards to a home health agency. There are a lot to choose out there, and you want to make sure you're getting the right home health agency for the services that you need. One of the best places, and it's actually in the questions, the interview questions that I put in there, one of the best places to go to check to see whether the home health agency that you're choosing is where it needs to be in regards to the compliance standards and the national standards or the national average. And that is through what they call, you can go to Home Health Compare, actually, and it's actually through Medicare.gov, and you can actually go in there and look for the ratings and of the surveys that have been submitted by individuals that have received home health in the past. And you can compare them to what the national standards are and to the other competitors within a certain area. You just put in your zip code and it brings up all the home health agencies within your area. Or if you know the name of the agency that you're looking to utilize, you can look at that prior to actually interviewing them so that you know who to use. And these are for Medicare certified agencies only. So you would not find any what we would call non-medical home health agencies on there or home service agencies. These are specifically for Medicare certified home health agencies providing a skilled level of medical and nursing care. Episodic means that it doesn't happen all the time. We're not there all the time. So we may be there, a nurse may be there twice a week or 3 times a week. Sometimes she's there, she starts out being there 5 days a week, and then by the second week, she's only there 3 times a week. And by the third week, she's only there twice a week. So these are what we call episodic. It's not happening all the time. It's for short periods of time over a certain period of time. So under the Medicare has changed a lot of the regulations in regards to home health. And one of the things that you need to be aware of is home health is there for people who specifically need skilled care. So what that means is they're there to help you with your medication management and understanding your medications and how to take them correctly, checking your blood pressure based on your diagnosis, doing your wound care and teaching you how to do it, making sure that you're not in pain. One of the biggest reasons home health is utilized is to cover people who are post-operatively in pain. A lot of times home health will be asked to go in and monitor the individual's pain and to make sure the medications that they're using are appropriate for the pain level. So the goal of that would be is that the nurse would come in, understand what the pain level is at the beginning of this episodic care episode. And then by the time that this person is a week or 2 weeks and there's no pain or the pain is managed at a level that is acceptable to the patient. So home health provides a lot of different education and training. We make sure that the environment that you are living in is safe and appropriate. We ask that you fill out upon admission an evacuation plan. How many people actually really know? This surprises me all the time, but sometimes I think in the beginning of home health, I was guilty of this too. When you ask someone, where would you go if you could not stay in your home because of a flood or a fire or a tornado? Where would you go? Who would you go to? How would you get out of your house in a fire? Where would you go if after a fire? How would we be able to get a hold of you if you had to leave your home? So these things are really important. And these are important for overall community health and for your overall safety. So home health is not only there to provide measures to take care of the immediate healthcare issue, but we're here to make sure that you stay safe in your home, that you develop healthy habits, that you stay compliant with your medication and the management of your disease process, that you take to heart the education that we're providing, and to make sure that you and your family do this together so that you stay out of the hospital, because one of the biggest goals of home health is to keep the individual out of the hospital or from returning to the hospital and get you back to the activities that you enjoy doing safely. Who is eligible for home health? Pretty much anyone who has either commercial insurance, who has a Medicare managed care plan, or who is on Medicare Part A and or B. These are the people who are eligible, but that's just the first part of the eligibility criteria. The second part is you have to be homebound, which means it has to mean that there's taxing effort for you to leave your home. The third one is that it has to be doctor ordered or ordered by a nurse practitioner. And it has to have what we call a skilled need, which means it can't be just to go in there and do homemaking or a bath or a making your bed or going grocery shopping. Those things are not covered under that skilled benefit level. Those things are in a totally different level of home services, and that's considered a non-medical model. Under the skilled medical model of home health, those things are not covered. So you would not expect to receive homemaking. You would not expect to receive someone cooking your meals or going grocery shopping for you as that level of care. What you would expect to see is what I've said before, which is the wound care, the medication administration, the medication management, injections, nutrition therapy, things that you would see in a hospital or that you would receive care for in a hospital or in a rehab facility or in a skilled nursing facility. Those are the levels of skilled care that you would receive through home health. So, is there anything else that
Yes,
I could answer?
I have some questions.
Sure.
I was just making some notes as we were going along and just looking at some of the things that I get asked regarding home care. And one of the things I will say, like Linda mentioned, you can get physical therapy in the home. Now, sometimes if, some of our seniors have a difficult time with their hip replacement or their most often their knee replacement. So sometimes you can get a physical therapist to come into the home, work with you for a couple of weeks, get you moving and get you a little bit more mobile, and then you would transition to go to outpatient. So oftentimes home care can be used as a transition period between coming home from the hospital and not feeling well to getting better enough that you can go into outpatient treatment. So Linda, one of the things people look is I hear objections sometimes where they don't want, how long are they going to be in here? How often do they come? If I was a patient coming out of the hospital, I was diagnosed with a congestive heart failure, and they were going to send me home with home health. I'm weak. They're going to give me some therapy. What might I expect from that home health nurse as when they come to see me and treat me for my congestive heart failure?
That's a really good question. Some home health agencies have what they call clinical pathways, which means they have very specific programs for those diagnoses. That's why it's really important that you interview the home health agencies, because if there is one out there within your area that's covered under your insurance plan, you may want to go with a home health agency that has what they call clinical pathway for that diagnosis, which means they have a very specific program for someone with congestive heart failure. So that means there's very specific steps and education that's done at every visit. But if they don't, that doesn't mean that they cannot provide good skilled care and education, which means upon admission, you would expect that clinician to do a complete physical assessment as with all patients that they bring on, that they would be asking you questions about your medication, that they would ask you what information you have or what is your understanding of the medications you're taking and why are you taking them. They're going to ask you if you know how to take them and when to take them and when to call the doctor. They're going to probably weigh you, and they're going to variance that weight based on the weight that they have from the hospital prior to discharge. Then they're going to probably provide you with a scale if you don't have one, or ask you to purchase one, because they're going to want to get a weight on you or have you weigh yourself every single day, because after a certain level, based on what weight change, based on doctor's orders, they may need to call the doctor and adjust your medications. So you'll expect them to talk to you about your diet. What do you eat? What do you like to eat? They're going to look at your home environment and they're going to see what exactly are you eating? What do you enjoy eating, and how we can make this a good win-win for you to make sure that you don't feel like you're starved, that you don't feel like you have to be, rigid, but that you're compliant with your medications and your disease process so that you don't end up back in the hospital, because that's the goal. And one of the things they're really going to sit down and work with you on is, what do you want? What do you expect out of these home health visits? What type of outcomes and goals do you want to reach? What would you like to see from each of the visits? And they're going to make up goals with your participation for your care that they will try to educate you with and discuss with you at each and every visit. And then they will work on a schedule with you based on where you are in your disease process and how fragile you are at the point of admission will determine how often that nurse comes out to work with you. But they're not only going to work with you, they're going to also work with any member of your household who is a willing and able caregiver who's going to be participating in your health care. Then that nurse will call and make a report to the therapist about her assessment, and then the therapist, she will let you know when the therapist will come out, and then physical therapy will come out, do their assessment, and then develop an exercise program to help you get back into condition so that you can go back to a normal baseline. If you have oxygen because of your congestive heart failure, the clinician will make sure that the DME company or the durable medical equipment company that has delivered your oxygen has provided you education on that. And then the nurse will also, the clinician and the therapist will reinforce that education at each and every visit to make sure that you are aware of what oxygen safety measures you have to have in the place in your home while you're on oxygen. The nurse will also make sure that you have an evacuation plan in place. She will make sure that you have a medication list with the different types of medication you're taking and why you're taking it. She may even help you set up your medication pill box if you're on quite a bit of medications or there's confusion. She will also contact your physician to make sure that there are no other additional orders based on your assessment that he may want you to implement now that this patient has been admitted to home health.
Linda, we have another question, and it was
Sure.
related to one of ours, and then we're getting almost on a half an hour, so then we'll wrap it up. I have two things. This is a real quick one. How that first visit is going to be a longer visit. About how long is that first visit?
It's usually anywhere between 1.5 and 2 hours.
Okay. Second thing is the subsequent visits on an average, what, last about 45 minutes?
Yeah, it's usually about 45 minutes for the visit and then 15 minutes for the clinician to document their visit.
Okay. So last question is we had a question about home infusion. And so the question was from Katrina is that I will read that so that everybody can hear that. My father-in-law had sepsis a couple months ago, 5 days in the hospital and then sent home, where his wife was to give him IV antibiotics for 10 days. That responsibility terrified her, so she ended up driving him to the hospital every day. Could we have had home health care for this?
Right. Medicare rules for home infusion have changed. The home infusions are no longer a covered benefit under Medicare home health. Home health have to request for specific licensure and specific training or acceptance to be able to provide home infusions. It's almost like you have to have a pharmacy license now to be able to provide certain home infusions. So you have to work very well with a infusion company. So there's processes that home health agencies have now need to go through if they want to provide infusions. A lot of times they're done through outpatient clinics and or by teaching the family members to do this. And it's just a recent change. It's just changed within this last year. But there are home health agencies that have this and are able to do it, but the majority of them will not have this as a covered benefit under that home health benefit anymore.
Thank you. I think that's something. Just look, I was just taking notes as we were going. We talked about home infusion. We talked about Bridget. We talked about a disease. So one last question. So on an average, Linda, what's the length of time that a home health agency, normally is in with a patient? How many weeks?
Probably about 45 days is the average. That's the national average for an individual to be under home health. Now, remember, that's an average, so that's the top of your bell curve. So there may be individuals that are on it for 5 days, 10 days, 7 days. And there could be people that are on it for 60 days, 75 days. A lot of it depends on the diagnosis and the services that we're providing and treating you for. 2, what your insurance will cover or what they authorize for care and services. And sometimes it's based on the patient themselves saying, I'm done, I've had it, I get it, I'm okay on my own, I don't want to do this anymore. So a lot of times the individual will also discharge based on, or because we've met our goals early. So, but the average is 45 days.
Last question, because it was good. The other one was going to be the last question, but this one led to this last question that we didn't really talk about. Can home health care? We talked about wound care. I know wound vacs are covered with home health, but the one thing we didn't talk about is, can home health come in every day?
They can, but not for any length of time. They usually can come in every day for a period of 3 or 4 days if the need is there. But the whole point of home health is to make sure that the individual is safe, that we can have someone to teach, or that we can get to a point where we can have the dressing changes or whatever every other day or every 3 days or every 5 days to be for the betterment of the individual and also for cost effectiveness. I mean, we have to be honest with you. There is a reason, but there's really no need anymore because of the high level of types of dressings we have and the advanced wound care that we have now. There's no longer a real need for daily wound care. We have different types of dressings now that we can apply one day and not have to come back for 2 days. Now, as I said, it's individualized and it's based on the diagnosis and the severity of the services that we're providing. So you could have someone from home health come in daily. Could be a nurse one day, could be a physical therapist the next day, could be occupational therapy the third day. And every single one of them have eyes on that individual patient and can report back to the nurse, who is the gatekeeper on this level of service, and let her know what's going on. So that frequency of visits can change. It can go up or down, but there has to be rationale for both.
Great answer. And I know it's very common. A lot of what we see is, if it's three times a week wound care, the home health agency will do it twice a week, and they'll go in to see the doctor once a week or see the surgeon. And that's
Correct.
something that's very,
Correct.
very common. So, Katrina, I hope we have answered most of your questions. We appreciate you being on with us tonight. And I think that's all I have. Linda, you have anything you want to say? Otherwise, we will.
No, just
wrap this
we'll
up.
be putting out our interview guide for you to use with the answers or the expectations of what you should hear from them as they respond to those questions. So just take a look at it, utilize it, and make sure you interview, because that's the most important thing you can do, is have a good fit between you and your healthcare provider. Thank you.
All right. Well, thank you, everybody. Have a great night. And what's coming up next? Wednesday, we are going to have a special. Wednesdays will be our special guest. We are going to have Anna Slayback come on. She Her specialty is in coaching patients with dementia and brain injury. And so we will have her come on Wednesday, and then Sunday, our new topic, we are going to be talking about diabetes. So with that being said, we hope you guys have a good night, and we'll see you soon. Take care. Bye-bye.
Bye-bye.